This is a phase 1 clinical trial with a completely novel compound that attacks cancer cells in a really different way from really any other currently used method. Most of our chemotherapies seek to injure cancer cells mostly by damaging their DNA or some of their other internal workings. CPI-613 is very unique in that it hits cancer cells in their mitochondria, and it basically alters their ability to make the building blocks of the next cancer cell. And we found some really interesting results with this during our phase 1 trial. We enrolled 26 patients in total. We had 21 of them who were evaluable for a response, and of them in a very heavily pretreated phase 1 cohort, we saw about a 40% response rate, stable disease or better, including several really outstanding responses. We had a 19-year-old girl who had relapsed Burkitt's lymphoma, which is a very aggressive form of non-Hodgkin's lymphoma, who had failed an allogeneic bone marrow transplant, which is sort of the last-ditch salvage therapy for it, and really had nothing else. Enrolled on our phase 1 clinical trial and had a sustained partial response for 17 months, and then ultimately opted to have her only site of disease surgically removed. And she's almost a year out from that surgery with no evidence of disease on no therapy. So we're really excited about her response. We also had a therapy-related therapy-related MDS patient who got a sustained complete remission, has been on drug now for 37 cycles, so going on 3 years, a little over 3 years, with really tolerating the drug exceedingly well. We did see in our study some evidence of acute renal failure, as well as some nausea and diarrhea as toxicities. Overall, it was very well tolerated, and we saw no myelosuppression, which we think is really unique, that this drug would have activity in some very aggressive heme malignancies, but not actually suppress normal hematopoiesis. So none of our patients had falls in their peripheral blood counts that were thought to be related to the drug. We're really excited about this compound at Wake Forest, and we've got a number of ongoing clinical trials using this drug. I myself am leading another phase 1 trial in relapsed AML patients in combination with chemotherapy, and we've preliminarily are seeing some very encouraging results, so we're going to keep moving ahead with that one. That one is accruing very well.